Yeah, so very quickly, a lot of you have submitted your ideas via Slido already. Please feel free to keep doing so. There are 4 idea rooms on Slido where you can see which topics fits best with your idea and keep entering your idea, because we're looking forward to expanding even more on what we've seen so far. Can we go to the next slide? So like Tim said, we have almost 300 ideas were entered yesterday, which is so great to see. All the engagement and all the great work that's already going on that we can build upon, and all the ideas for even more future work that are out there. So we made a very short overview of the ideas per category, so you can see the 4 categories that Tim also introduced, and then we added another one which is a bit more on coordination and governance for the really overarching ideas that were entered. You can see that the majority of the ideas was in the Amplify category, so a lot of inspiration there, but also in the other categories we had a lot of interesting input. Can you move to the next slide, please? So zooming into the first 3 rooms, identifying evidence, simplifying knowledge, and amplifying action. We had a look at the ideas there and kind of categorize all the ideas into smaller to see a bit like what are the different types of ideas that we're seeing. So when we're looking at identifying evidence, we see a lot of inputs of suggestions of new collaborations, new ways of working, and new tools. And the other categories were scanning of research. How can we do that in a smart way? And how do we intelligently review and verify the evidence? So when looking at simplifying knowledge, a large bucket of ideas was into the knowledge translation area. So how do we translate knowledge into evidence and policy and into understandable messages? Part of the ideas was on drawings and multimedia. So how can we use those tools to convey our message, and a few on new collaborations or product ideas. And when we look at the amplifying part, also a lot of ideas on new collaborations and new tools, a chunk on engaging influencers, and a very small part of, which is more in the management and coordination area. So we'll talk a little bit more about all these 3 categories. We can go to the next slide, please, Tina, thank you. So first, when we zoom into the first bucket of identifying evidence, we've tried to give you a bit of an overview of what were main actions that people have stated, and are they global actions for WHO? Are they actions for country states, for the member states, sorry, or are they global actions for other actors such as NGOs, academia, such parties? So bit of highlights here, global actions for WHO, mainly see if you can come up with an official website to publish weekly most relevant fake news as a source for others to use and to battle this misinformation. On the reviewing and verifying side, for WHO, the request to translate information for opinion leaders, social media influencers to use correct information from scientific societies. For the country states, member states, the main message was to member states to design priority messages for the general public, to share them systematically, and for other actors to really engage fact-checking organizations to disseminate verified information, and to use artificial intelligence power to analyze the vast amounts of scientific data that's generated in the literature to see if we can more efficiently analyze that and more quickly take out the interesting information that needs to be spread through the community. So we can go to the next one. So we did the similar exercise for topic 2, simplifying the knowledge. Here a bit more points, so I'll just quickly highlight a few to not take up too much time. First of all, for WHO, big one was to foster a platform showing best practices on communication so that others can learn from these global best practices, and compiling a list of global product ideas and to disseminate these to make it the uptake of new innovations much quicker. Then actions for the member states. really consider the principles of making the information more understandable in your national communications. Very important one. And also to compile lists of national product ideas that could maybe feed into the global ones. Then for other actors, to look into repository and databases for infographics and materials for easy access, maybe also overarching borders so that multiple countries can enjoy these, and look into national multidisciplinary research networks. Then there were a few inputs more on the multimedia side, which I'll not go into detail now. Can we go to the next slide? So when we're looking at amplifying action, as you can see, a lot of inputs there. This was also the biggest category, of course. Just to highlight a few for WHO, really ensure that communications are translated and adapted for communities' needs, especially marginalized communities. Mentioned a few times also, to not forget the communities who are people who are living in refugee settings, for instance, people in lower resource or very rural settings that have very different access to information. Then to really make use of the key influencers to amplify messages, and also at a community level. So maybe look also into community health workers, local ambassadors, that type of thing. Then on the tools, and to really collaborate with the private sector. This was something that actually came up in quite a few ideas, not only for WHO, but also for other actors, to really look into the collaborations there to amplify our possibilities. And on the coordination side, that WHO can really take a leadership role in managing the infodemic. Then for the member states, again, really find ways to diffuse information at the community level. That's something that came up a lot. And another more practical idea is to really use softwares to translate materials into local languages. Then for the other actors, again, look into that community-based approach, make sure you engage young people, and leverage technology to amplify your messages. Can we go to the next slide? Thank you. So then zooming into the fourth category, which is more on quantifying the infodemic, where we saw a lot of inputs really on more on the research spectrum. So how to analyze non-digital and digital data, with really also a little bit of some inputs that really specifically focus on non-digital data. So we don't, with the message not to only focus on the digital data, although that's a very big part, of course, of this infodemic and of our response. Then some input on new tools and research messages, modeling and predictive analysis, and also in ideas for indicators to quantify the infodemic. Go to the next slide. So here, if we look at the specific calls for action, I hope you can also see the bottom of the slide. Sorry, I see they may fall off the screen, but you can also look back into in the Google Docs to look a bit more closely as this waterfall of information I imagine we're putting on you right now. But so in the quantification bucket, looking at the global actions, something that came up several times was that it would be great if there's a WHO dashboard on infodemic monitoring and not only on the epidemic monitoring. So that's an interesting one. Can WHO help form the research agenda to fill gaps in research, and set up a working group to define indicators and develop metadata standards, and look into protocols for evidence-based approaches to behavioral dimensions of public health. Then for the member states, kind of do the same as this global dashboard, but also look into local web-based models, really focusing on the local country data, use mobile surveys to measure adherence, so that you can add to the digital data that's already out there, and do country level dipstick surveys to really know what's going on. Then for the other actors, look into repositories of misinformation, where we can track patterns and trends of misinformation. Another highlight was to link to social network sciences, to use that information to analyze more how we see misinformation spreading and model the vulnerability and misinformation aspects. So then moving on to the last topic. So the coordination and governance are some ideas that were specifically in this field, really focus, most of them really focusing on promoting integration and collaboration. We'll show some examples on the next slide. So big call to WHO again, to build a network of collaborating centers, if you've already heard of one this afternoon as well, to develop guidelines on remote risk communication, and even more high level to come up with a framework of principles and a strategy for infodemic response. And then another one was quite specifically on the ethics. So to not forget that there are quite varying ethical views on how to manage misinformation over different countries, and that some guidance on what is acceptable and what is not could be very valuable. Them looking at the countries to really set up, there it is again, the collaborations including the private sector, civil societies and public sector. So to really see if that can help this infodemic response. Another one was on setting up task forces. There is a great example from Italy where they just set up these task forces, specific task forces on disinformation management and also data science in the epidemic. And then lastly, for other actors, some calls for integrated information systems, for instance, at the EU level, and international platforms to communicate evidence-based responses. So that as a summary on all the actions. I realize this is a lot of information. I hope our panelists can help us make sense of it. Then lastly, there are a few, if you can go to the next slide, thank you. A few highlights we wanted to share with you of interesting comments and ideas. So first of all, of course, something we like to hear, and I think WHO is also very interested in doing, is can this consultation lead to an overarching strategy for addressing mis and disinformation in this pandemic? So I think that's a very important call to action for all of us. Then in interesting statements we've also heard in the talks yesterday on incentives, we need to understand much better how different actors profit from this misinformation and how we can use that to fight it. Then some nice creative ideas more on the communication side. So to develop a COVID-19 game, there are now more than 2.5 billion gamers across the world. That's quite an audience we could leverage. Also, another very important point, that we don't forget the populations without internet access or without regular internet access. Perhaps sending verified messages, both SMS and IVR, in their local languages, and having active toll-free call centers, for instance. Many things to consider. And not only on the communication side, but also on the data collection side, that we don't forget these large populations. Then a quote on the evidence-based approach of behavioral measures. So evidence-based approaches on the effectiveness of behavioral dimension of public health measures are really needed, and we should develop protocols on this. So it's an interesting new field there to dive into. And then lastly, understanding your audience. Nice quote we found: as much as it is important to identify the correct evidence, it is equally important to know what are the population's main concerns. So I would like to leave you with that, and back over to you, Tim.
Thanks a lot, Judith. That's an excellent summary. And I would like to remind the audience that we are still collecting this information and your ideas. So please keep them coming. We're happy to look at them and see how we can integrate it into our framework. Also, lots what you see now in the summer, we'll try to reformulate and synthesize a little bit more. But given the time frame we only had, since this morning, the team did an amazing job in analyzing those ideas and giving us a first snapshot of the situation. Please keep your questions coming to us. After our policymakers have spoken, we will take again a couple of questions from the audience to reflect back to Judith and what they have seen in their analysis, as well as to Dr. Viroj and Dr. Neville to reflect on also the questions coming from the audience. So please go to Slido and submit your questions to the plenary meeting room, and we then take those up and and discuss them towards the end of this session. So without further ado, I would like to start with Dr. Viroj from the Minister of Health in Thailand, if he can give us his perspective on the ideas he heard so far. So Dr. Viroj, I hope you're online. Over to you.
Thank you, Tim. Can I share screen?
Please.
I have jotted down my word file.
I have stopped sharing, so I think you can now start sharing the screen.
Yes, thank you very much, Tim, and thank you for the opportunities. I have involved with COVID-19, supporting MOH on many fronts, and now we are conducting a national survey of adherence to social and physical distancing through Google platform. And we have some 50,000 respondents so far. So it is a daily survey to monitor change in adherence. And next month we plan to survey infodemic and etc. So this is just a timely contribution. So I appreciate the matrix of actions by the WHO, member state and other stakeholders has presented by Judith. My comment on the 4 pillars of infodemic management. First and foremost is the identification of authentic evidence as well as the verification of misinformation. This requires strong and effective international collaboration. Yesterday we heard very clearly that AFP fake check is very useful and it is a big platform. Misinformation cross-border and countries have limited capacity to verify whether it's a fake or not fake, conspiracy theory, etc. This is a key normative function of the WHO in collaboration with our international partners. Also, country can analyze and submit social media messages for verification to the WHO and other partners. So this requires strong international collaboration because I believe that country, even in Thailand, we have limited capacity to verify international message, whether it's fake or not fake. But domestic, we have due capacity to verify and take legal actions. Second pillar is simplify knowledge. I think this is mostly in the limit of the country because there are different socio-economic, cultural, linguistic, and religious contexts. Therefore, countries should be empowered to simplify the authentic knowledge and transmit into the third pillar, which is amplify positive action and also rebut action. A positive message and rebuttal action is, I think my perspective is the country mandates. They have legal mandate, they have regulatory mandate. The goal is to build trust to ensure, as our Indian colleague said, right information are transmitted to right people in right format and at the right time. I like the matrix of topic, rebuttal, and technique of rebuttal. And our presenter today talk about science cannot guarantee 100% effectiveness. For example, social distancing is not 100% effective. So this is a false expectation. And this discourse should be transmitted to the society that it is a good enough, it is, there's nothing 100% because multifactorial. When you're exposed to risks and nothing is 100% effective like vaccine. Then we need to maximize use of social media platform, WhatsApp, Line. In Asia, we use a lot of Line. Less so on Twitter in Thailand, but we use a lot of Line communication. Even lay people, they have Line communication through a trusted and authentic agency. Use of video, clip, and infographic, cartoon will be very useful for lay people. We need to have a cultural friendly messaging And we believe that repeated correct message result in change in behavior. Therefore, on air, on social media, messaging in positive and correct message is so important. And timely counteracting misinformation. At the same time, we have to apply Mythbuster through mobile application if possible. I think the Indian watch Caro is very interesting to be scaled up. On the fourth pillar, I think on the impact assessment, the global dashboard on infodemic monitoring can be very useful. And we felt that high potential for scientific and international collaboration on impact assessment. We need to have develop indicator both infodemic size and I think that the national dashboard, for example, the positive knowledge, change in attitude and practice, increase awareness of risk to infection and corrective response, general people perspective on corrective response by citizens to overcome COVID is so important, and also adherence to physical distancing. We need to maximize use of social media platforms such as Google platforms for the survey of impact of infodemic on attitude and behavior. On the fifth dimension, which is governance, we need better coordination between the virtual member state, key stakeholder, and private sector, in particular the social media platform. So I think the PowerPoint that Judith has presented is a good start, that we have to take action fast. And I look forward to further collaboration with the WHO. Maybe Thailand can be a pathfinder country in implementing infodemic management system. We are ready to support and work together. Over to you, Tim.
Thank you so much, Dr. Viroj, and also putting your ideas on paper, and also having audience an insightful view about your perspective. And of course, we will take up your offer, and hopefully Thailand can be a pathfinder country in the things that we want to do next after this meeting. Now I would like to go to Dr. Neville Calleja from the Ministry of Health in Malta. Neville, can I invite you to comment? Over to you.
Sure. Hi Tim. Hi everyone. Thanks for inviting me. So for anybody who doesn't know where Malta is, I don't blame you. It's a very small country somewhere between Europe and Africa, or an island country in the center of the Mediterranean Sea, 500,000 population. So, being a policymaker in the COVID-19 pandemic in this kind of setting brings particular challenges and opportunities. So if I may, I put up some points of my own. So I'm not sure if I think I don't have access to the screen yet.
Dr. Viroj, you need to take off your screen sharing. Okay, over to you now, Neville.
Sure, thank you. So, yeah. So I'll make this a bit larger. I hope it's okay. So I just put some points as I was listening to Professor Viroj. Basically, I'm not sure if everyone understands this, but basically when you're a policymaker working on a pandemic like this, a number of rules that we are accustomed to in public health just basically go out of the window, okay? So your time comes at a premium, you're sleep deprived, you don't have holidays, you're just bombarded with lots of things, you're doing much more than you have experience in doing, and you're expected to deliver the right thing the first time that you actually try doing it. I mean, after I finish this conference, I have to go and check on some charter jumbo jets getting us supplies, which is something that I didn't used to do before working on COVID. So time comes at a premium. You also have, obviously, lots of people sitting at home on social media. So the R naught, if we can say so, of the infodemic gets worse than what usually happens on, you know, if I can call it so, peacetime social media engagement. And we also have a setting where we have relaxed rules and standards. What do I mean here? So also in the interests, obviously, of saving people's lives, we're seeing a setting where many journals are sharing papers on COVID, even pre-review. There's a lot of material out there. Not everything has been reviewed yet or quality assured. So this presents some challenges. I guess it also presented a lot of challenges for the international organizations to engage. So I must admit, one thing that we have missed as policymakers in countries is that we were not getting as much guidance from a number of organizations we usually follow as we're usually accustomed to. And probably the biggest reason for this are basically the reasons I've just mentioned, particularly the speed at which things are developing and also the quality assurance of material out there. So then there are other challenges you have to face when trying to communicate. Firstly, what is the right info? I don't think we can go away with that idea that everything is either white or black. Okay, so we have a lot of situations where evidence has made us eat back statements that we have been insisting on in the past and admitting that the right thing might actually be a different thing. Case in point, we're just seeing evidence right now being published, especially within Europe, on the use of face masks in the community, something which we have been resisting, so to say, for a number of months since the beginning of the pandemic. Something else you need to keep in mind is, again, and this is particularly for people like, you know, epidemiologists like me, for example, who are usually trained to go for the highest standard possible. As medical professionals, we usually get pushed towards achieving the best standards possible. You only use verified information, etc., etc. Unfortunately, you might have to make compromises in situations like this. Okay, so we need to keep in mind that, you know, what we call the 80-20 rule still applies. Achieving perfection usually costs you much more in terms of resources, time, everything, than it would cost you to achieve, you know, reasonable accuracy or reasonable coverage in anything. So I must admit, amongst the ideas that have been shared, I have a few favorite ones. My those that do not take the time factor into account. For example, I must admit, the weekly reporting of fake news, I don't think I would have found that particularly useful, because the way information spreads on social media is very fast, and before you know it either dies on its own or another challenge comes along. So weekly reporting, I don't think is fast enough. On the other hand, the last 2 days of AI-driven AI-driven measures and websites that are very easy for people to use to verify whether facts are correct or not. We've seen two examples, one which is possibly very much human, it requires a lot of human input, like the AFP example. Then there was the Canadian example that looks maybe, I don't know, maybe I misunderstood, but it looks a bit more automated, so potentially more responsive. And such AI needs to be applied across platforms. So I've mentioned a few platforms there. I know some platforms are more popular in some of our countries and others less so. But I've noticed in combating infodemic here in Malta that messages frequently switch from one platform to the next. So we need to be aware of what's happening on all platforms, even from WeChat, for example, to WhatsApp or Facebook. Huh? We've seen a lot of these movements as well. That said, we do need highly responsive international organizations. And by response, I mean developing shareable material. I can't imagine that they would manage to develop it as fast as the fake news, but it would definitely be useful if they could try. Also, what could also be useful is to engage with public health authorities on a regular basis, because we don't only communicate through social media, of course. If I take our example here in Malta, we have established a daily briefing by the public health chief. And basically, if there is something running around, we're monitoring the social media, we feed each other. If there's something running around, we try to address it in the press briefing and try to kill it right away. So this might be possible in a smaller country, maybe less possible in a larger country, I admit that. Sharing. A number of points have been mentioned on sharing, networking, linking up collaborating centers. I just can't tell you how priceless that would be. I mean, one of the biggest challenges that we've been facing is the huge demand for specific information. You get sectors asking for guidance that you might not have thought about before. I'll give you a few examples of what I got. Queries from workers sorting out recycling garbage. How should we deal with the garbage? Waste management, public transport, undertakers, everyone has been coming for specific guidelines. Repairmen, going into houses, how they should behave. And unfortunately, every time we had to scour Google and try to find something out there. So it would have been so nice if we had some kind of forum just share this. And we already actually received through our foreign affairs people requests from other countries to share guidelines like this. So it's definitely something that most people are feeling. The private sector. Definitely, I mean, it's not just the private sector, actually. The experience has been that all sectors rally to help, pretty much. Okay, so as a general rule, most people would rally to help. In fact, it's usually more of a problem trying to manage all the offers for help rather than finding help. So, and the private sector can be quite innovative, much more than the public health authority usually can be. Nonetheless, that comes with a warning, and I'll give you a little story from our own experience. We had someone setting up what looked like a genuine COVID-19 information sharing platform on Facebook. It was at the right time. Unfortunately, and I admit, we should have set this up ourselves as public health authorities first, and not let someone out there set it up. So it looked like a genuine initiative. We engaged with it. We said, nice initiative from the private sector. And then we realized after that they had garnered around 40,000 members, and this is a forum that was addressing a population of 500,000, so 40,000 out of 500,000 is fairly substantial. Then we could see that that they were pitching more panic into the group, and then when it reached a certain critical level, they started advertising their own website, selling face masks at exorbitant prices. When we started protesting, they started blocking every person who comments. actually kept many members in the group. And keep this in mind, when people enter a group, they very rarely leave. So this is an experience I wanted to share with you, because I must admit we were caught out. Automated translation would definitely have been useful for us, not only translation of materials that we publish, but also ideally automated interpretation of any media communication. So we have a fairly cosmopolitan population now on this little island of ours, and you know, coping with all the languages is quite a challenge. So doing it manually would not be really possible. Automated translation, yes, will lead to some gaffes because it has limitations. Okay, so you might be saying something wrong in one language as opposed to another, but I think it's a risk one should take as opposed to not communicating at all. Indicators framework, yes, I would agree. I think we should consider this prospectively. So we should learn from the experience of COVID to also have such a framework in place for any future pandemics. I'm not sure it will be super effective now for COVID-19, given the timeline of the epidemic. Community level dipstick surveys is another idea I like. We are working on instituting this, and I'll tell you why we wanted to do this. Because what you get from social media, so with all the big data approaches, okay, will not give you a good insight of what the rest of the population behind the digital divide is thinking. So we want to actually try and speak to people on the phone. We've commissioned our statistics office to carry out such surveys on behavior, on symptomatology, and there's actually a guidance document by WHO, which was very, very useful. I must thank anyone who has been behind it, to try and carry out such community level surveys. Again, we realized from the presentation of cases amongst the elderly that there was a morbid fear amongst the elderly to swab. This was not coming to us through social media, because these elderly were using social media less. So they were not sharing their fears on social media. We realized this then through community service. And one last point, if you allow me, is the issue of ethics of communication. I don't think there are any fantastic rules on this one, but from experience, I think respect is key, okay? Nobody should be treated as like he's saying something stupid, okay? No comment, no post is stupid. So we need to respect anyone. There's a lot of anxiety out there, so let's not be paternalistic towards anyone, because that's where it fails. I must admit that those of us who are most successful in engaging on social media usually start with finding what you can agree on. Usually a comment has good elements and bad elements, okay? If you can agree on something, start with that, and then, you know, correct whatever is wrong. What I also find is that arguing, you know, you get comments and reactions, and it's very counterproductive. You waste a lot of time. This is like dealing with an anti-vax person on social media. You know, it usually goes on endlessly as long as you are willing to engage. So we have had the experience that when you deliver decisive messages in clear layman's terms, and you obviously have to keep in mind to be as clear as you can, that your that whatever you're saying can't be twisted that much, you actually establish yourself easily as an authority. I've had that experience after engaging intensively for a few weeks on some of the bigger groups in the local social media landscape. And eventually I realized that when I commented on certain posts, the comments stopped. Nobody commented anymore. So if you do this properly, people start respecting you. That was the experience we have seen. So I think I've talked long enough here. I've taken a lot of your time. So this is just a reflection on how relevant I feel those ideas were to our own experience. Back to you, Tim.
Thank you so much, Neville. We could have listened, more and more to you because, you help us ground these ideas to reality. Sometimes we might go off in many ways, but listening to policymakers and the day-to-day challenges you face really, grounds us again and see where we can set priorities in the way we're doing. So thank you to you and to Dr. Viroj for really giving us perspective on this.